Welcome back to the audio guide from Pennsylvania Medical Marijuana Cards. If you or a loved one is dealing with a severe diagnosis like ALS, finding meaningful symptom relief can feel like an uphill battle. Today, we are discussing exactly how amyotrophic lateral sclerosis fits into Pennsylvania's medical marijuana program.
It really is one of the most profound conditions we address at PennsylvaniaMarijuanaCards.com. ALS is explicitly named as a qualifying serious medical condition under PA's Act 16. While cannabis cannot cure the underlying disease, the clinical focus here is entirely on improving the day-to-day quality of life.
Right, and managing the daily burden is key because standard medications like riluzole only slow progression modestly. Let's look at what the science actually says. You guys just reviewed a massive 2024 retrospective study from the University of Texas ALS Certified Treatment Center, right? What did that data reveal?
Yes, it's the most current and honest data we have on 344 ALS patients. The findings were very nuanced. The study confirmed that medical marijuana has a strong, statistically significant correlation with short-term improvements in pain, poor appetite, and anxiety. However, it tempered expectations for things like insomnia and spasticity, where the results were mixed.
That's an important reality check. It targets specific symptoms. It's not a blanket miracle. Let's talk about pain first, because ALS pain comes from so many sources. Muscle spasms, joint strain from immobility, and nerve discomfort. How does cannabis help there?
The endocannabinoid system has receptors concentrated heavily right in the motor neurons, the exact cells ALS affects. THC acts as a primary pain reliever, while balanced THC to CBD formulations are usually recommended to keep side effects low. For appetite loss and wasting, THC is also a well-proven simulator.
That makes total sense. Now, what about the actual logistics for an ALS patient? If someone is experiencing advanced symptoms like trouble speaking, severe fatigue, or mobility challenges, how on earth do they manage an evaluation or visit a dispensary?
This is where the state's caregiver pathway is a lifesaver. Pennsylvania allows up to 2 designated caregivers per patient. A family member or care aide can be right there to assist during the telehealth appointment. Once registered, that caregiver can complete the state profile and handle all dispensary purchases on the patient's behalf. The patient never has to leave their home.
Wow, that completely removes the physical barrier. What about product choices? Swallowing can become difficult with bulbar onset ALS, and respiratory health is always a priority. Inhalation sounds risky.
Absolutely. Smoking or vaporizing is generally not appropriate as respiratory function declines. Instead, liquid tinctures and sublingual oils are the gold standard here. They allow precise drop-by-drop dosing, don't burden the lungs, and can be easily administered by a caregiver. Long-acting dermal patches are also fantastic for steady, all-day relief.
Now, your guide emphasizes a crucial warning regarding medication interactions and hospice care. We need to touch on that.
Yes, 2 critical pieces of advice. First, CBD can slow down the metabolism of the common ALS drug riluzole, which might elevate liver enzymes. You must discuss this with your neurologist. Second, if a patient enters Medicare-funded hospice, federal law prevents the hospice staff from certifying or handling cannabis. Families must secure the PA card independently through a registered doctor.
That is vital information for families planning ahead. So if a caregiver or patient wants to safely start this process through your platform, what does that look like?
We keep it completely seamless. Step 1 is filling out our 3-minute online intake form at PennsylvaniaMarijuanaCards.com. Step 2 is the telehealth evaluation. You'll consult directly with a fully registered PA physician, like Dr. Jonathan Chance Miller, whose official medical license and NPI numbers are fully transparent and verifiable right on our site.
Love that transparency. And what if the doctor reviews the case and honestly feels medical cannabis isn't safe or appropriate for their current symptom regimen?
Then there is zero financial risk. If our physicians determine you do not qualify or that it isn't a safe fit, your $159 fee is fully and instantly refunded. If you are approved, Step 3 is automatic. We submit the state certification the exact same day, so your caregiver can get their physical card in the mail.
Smooth, entirely risk-free, and compassionate. A true patient-first model for families navigating an incredibly tough diagnosis.
Exactly. Don't guess about symptom relief or struggle with travel. Head to PennsylvaniaMarijuanaCards.com. Fill out the quick intake form at the top of our page and let our medical team guide you through every step.
Book your compassionate telehealth visit today at PennsylvaniaMarijuanaCards.com. Thank you for listening and take care.